Hi everyone, welcome back to my channel. My name is Ashish and I'm a junior doctor working in the UK. In today's video, I'll talk about the UK surgical training pathway. Before I start this video, I want to say that if you support my work, then you can do so by clicking on the like button, sharing this video with your friends, and clicking on the subscribe button. So let's start. So what all surgical specialties can you train in the UK? The answer to this question is that there are 10 surgical specialties which include general surgery, cardiothoracic surgery, neurosurgery, oral and maxillofacial surgery, ENT, pediatric surgery, plastic surgery, TNO, urology and vascular surgery. Let's talk about the pathway here. So this pathway is one of the common pathways taken by most IMGs who get into surgical training, which is core surgical training. First of all, they complete their MBBS training from their home country. Then they need to complete IELTS or OAT and pass all the PLABs to get registered with GMC. Then they usually work as a doctor in a non-training surgical post for 1 year in the UK. During this time, they build their portfolio and their CV, and they get a CREST form signed by a consultant whom they have worked with to get foundation competencies. Once this is done, they apply for core surgical training through ORIAL, and once their portfolio and their application is approved, they get longlisted and then they appear for interviews for core surgical training. And once they are successful in these interviews, they get shortlisted. If you are shortlisted for a core surgical specialty training, you get a national training number and then you can start your training. And you complete your core surgical training and try to pass all the MRCS exams before starting core surgical training or during this training. After you have completed your MRCS exams and you have made a portfolio for specialty training, then you apply for specialty training, which is a higher level of training in the specialty of your choice. When you apply for specialty training, you go through the same procedure, apply through ORIAL, you get longlisted and then appear for interviews. And once you're successful in these interviews, then you get shortlisted. After completing the specialty training, you also have to pass all the FRCS exams. And once you do all of these things, you get CCT, which is Certificate of Completion of Training. And then you are eligible to become a consultant in the UK or in other countries. Important points to note here are that you should not exceed 18 months of surgical experience after your internship or foundation years in any of the countries, because if you do so, you'll be overqualified for core surgical training and you can't apply for this. And then you can apply for higher surgical training, which is specialty training. And this is a totally different pathway, which is called a CESR pathway. Or you can get some alternate competencies for core surgical training signed and then can apply for ST3. To summarize, you start with having foundation competencies, which is by getting CREST form signed while you're working as a non-trainee, and then you go for core training, which is for 2 years. After that, you apply for specialty training, which is for 6 years, and this 6 years duration is for general surgery specialty training and not other surgical specialties like neurosurgery or cardiothoracic surgery or anything else. And after you complete your general surgery specialty training and pass your FRCS, then you get a CCT and then you can become a consultant. So that's all for this video. I hope that this video cleared some doubts which were in your mind. If you have any further queries, then you can comment in the comment section of this video, or you can text me on Instagram and I'll try to solve your questions. You can also follow my blog on Medium, or you can follow my blog on Blogspot, and I'll see you in another video. So thanks for watching.